Good afternoon. Yes, Mr. Gill.
Lord, the next witness is Sheila Hall.
Very good.
Her statement is SCIWT 0360 and 501.
Now, good afternoon, Miss Hall. Could you please take a seat? Thank you. Make yourself comfortable. Now, Mr. Gill, when you're ready.
Hello again, Miss Hall.
Hello.
You gave evidence 3 weeks ago or thereby as part of the core committee group of the care home residents group.
Care home relatives. Yeah.
Relatives, I'm sorry, obviously residents.
Yes.
Relatives group, and you're here now to provide a personal statement.
Correct.
Your full name is Sheila Catherine Callis Hall.
Correct.
The inquiry has your personal details and your way of contacting you. You're now retired. You retired in 2015. But before that, you had 40 years of experience as a registered nurse and midwife.
Yes.
And you tell us that you worked in A&E departments, not just in this country, but in other countries, I think.
Correct. I travelled a lot and worked abroad, yeah.
And you completed a degree in travel medicine, and you also set up a training company.
Yes, I set up my own training company that I ran for 15 years, teaching nurses, GPs, pharmacists in the UK.
And what were you teaching them?
Travel medicine.
Travel medicine.
So it was travel vaccines and world health and issues like that.
Yeah. Are you still operating your company, or is that...
No, I sold the company when I retired. Okay. The company is still going, but...
Yeah. Now, you're here to tell us about your mother, Alice Hall.
Yes.
And your mother was in a care home throughout the pandemic.
Yes.
And she died earlier this year.
She did.
Age 98.
Yes.
And you tell us a little bit about her background, and you describe her as being kind, smart, articulate. She read her daily newspaper. She followed world events on her iPad.
She did.
And she did that, as I understand it, really until her last few weeks.
5 days before she died, she was using her iPad, yeah.
And you also tell us, and this in the context of her life after she moved into a care home, that she thrived on company.
She did. She did. My dad was a Church of Scotland minister, and Mum was your archetypical minister's wife, and she was just the kindest person. She was always wanting to do things for people and make sure other people were happy, and yeah, and she did. She thrived on company. She was a very sociable lady.
Mm-hmm. And that continued, I think, even when she was in a care home.
Indeed.
And she also tried to keep active, I think, by walking, even with the aid of a Zimmer frame.
Yes, she was a very determined lady. I mean, she had so many falls and setbacks and always bounced back. She was unbelievable, to be honest.
Yeah, you tell us she went to exercise classes. She was able to leave the care home. She went to church.
Indeed, yes. She moved through to Glasgow from the East Coast. We're a very small family, and I'm her only daughter. Yeah. And she moved to be close to me, and we carried on having she was great company. Great company. We'd go out every couple of days and go to concerts, go to shops, go out for meals, yeah.
Mm-hmm. And I think you've just mentioned that she and your late father lived in Fife.
Correct.
And after your father's death, and after her health started to deteriorate somewhat, you decided, and in consultation with her, that she would move to be closer to you in Glasgow.
Yes, I mean, we coped for a couple of years with increasing support from carers, but with her health deteriorating, and I was an hour and 15 minutes drive away, and it just became unsustainable.
Mm-hmm. And did she take well to moving to the west?
She kept saying she was doing it for me because she worried about me doing all the driving. Mm-hmm. And that was just typical of Mum. So she said, yes, I'll move west and then I can be near you. And that was the important thing. We had a very close bond, and the fact she could be near me was very important.
Yeah. To both of you?
Oh, to both of us, yes.
Yeah. She was also somebody who took a lot of pride in her appearance.
Yes. Not in a glamorous way, but she was always a very smart lady, and she liked everything to be neat and tidy, and she was always immaculately turned out.
Fastidious? Fastidious,
yes.
Good word, okay. The room that she had in the care home that she moved into, I think you were involved in personalising it for her.
Oh, absolutely, yeah, which was very important to her, and she had some of her own furniture and her photographs, and she loved plants and flowers, and she couldn't manage them, but I would. Oh, she always had a vase of fresh flowers and nice plants in her room.
Mm-hmm. Now, I think there was a first move into a care home in February 2018, but that wasn't successful.
No, that was the first care home that Mum moved close to me, and it just didn't work because of various problems with management. But I think the important point from that is that I was in virtually every day and could appreciate what was going wrong and was there to support Mum to make a move.
Yeah. And I think you then chose another care home, and she moved there. Is that right?
That's right, yes, just a few months before COVID.
And I think, yeah. And I don't want to go in any great detail to how your mother came to be in a care home, because you set that out very fully in your statement at paragraphs 6 to 15. But prior to your father's death, she played, as you've said, a part in local organisations.
Oh, huge part, yeah. She was, she volunteered in a nursery school that was her original training, was a nursery school teacher, and she was a volunteer in the playgroup in the village for, gosh, must have been about 20 years, and was affectionately known as Granny Hall, and also in the Old People's Centre, and she was involved in the church and the WRI, and she was a wonderful knitter, and yeah, she was just very well known in the village.
Mm-hmm. She moved to Mugdock House Care Home in Bearsden.
Yes.
In November 2019.
Yes.
And you set out the circumstances of that care home in paragraphs 9 to 15 of your statement, and again we can, for present purposes, take that as read, but yes, we will obviously have regard to it. One thing you do say is that, albeit that she had moved into a care home, your mother could still eat independently.
Yes, yes. Her condition meant she lost feeling in her hands and feet, so she used to be slightly embarrassed sometimes eating, but yes, she could.
And while she was in a dementia unit, she didn't suffer dementia.
No, she was in what was referred to as frail elderly unit.
Oh, right.
But just the way that care homes are now, the majority of people in the frail elderly unit had a degree of dementia. Yeah. And Mum spent her time helping these people, to be honest.
And you describe her as being sharp as a tack.
Oh, yes.
Yeah. You visited her almost every day, I think.
Correct, I was just 10 minutes away.
Yeah. And you also would communicate by phone each evening?
Yeah, she phoned me most evenings and she spoke to my brother every evening.
And if there were an emergency, you could be there very quickly?
Yes. Mum was a worrier, not on the surface, but she did worry and she leant on me greatly to just run things past and get reassurance. And there were a few times if she wasn't well during the night, she would say, please call Sheila, and I would go up and sort out whatever it was. I was her fixer, if you like.
Yeah. Lockdown, well, before we get to lockdown, paragraph 15 of your statement, you say, and it's really a summary, pre-COVID, I was in and out of the care home whenever I wanted to see her.
Yes, absolutely.
And there were no restrictions. You could take her to a concert, arrive back home with her at 11 in the evening without there being any problems.
Yes.
And as you say, we treated it as if it were Mum's studio flat, and I was her main carer, advocate and friend.
Absolutely.
And was that recognised by the care home?
I think so. I mean, everybody loved Mum because she was good chat, and so all the carers would go into her room and tell them about their kids and all, you know. So yeah, we just came and went, and it was a great atmosphere.
Yeah. And we've heard from other witnesses, and I'm sure we'll hear from others, that where somebody like yourself, as a daughter, became an integral part of the care of your mother, and thus relieved the care home staff to a certain extent of some of their responsibilities.
Oh yeah, I would, without a doubt.
Yeah. Right. Lockdown. Your mother's care home closed on the 12th of March 2020,
Yes.
as you say in paragraph 16. And you originally thought that it might be something like a shutdown as caused by norovirus.
Yeah.
I think, as you say in paragraph 17, you went up with presumably your dog to see her and to chat through the fence, and you were told that you weren't allowed to do that, and the carer with your mother started pulling her wheelchair away.
Yes.
And you say that this really upset your mother, and it also raised alarm bells with me.
Yeah.
Right. A little more detail of that, please. First of all, how did your mother manifest being upset by that, and what was your particular concern?
Well, I guess perhaps naively, as I say, the care home had been shut down. The whole of society was in flux, not knowing quite what was going to be happening. We hadn't been told at that point that we had to stay in our homes. I hadn't got quite to that stage, so I'd driven down to the care home because Mum said, I'm going to go out to the garden with one of the carers this afternoon. And I said, well, I'll come down and have a chat with you through the fence. And as I say, when I arrived, the lady that was with her just started pulling the wheelchair away and said, you can't do it, you can't, Sheila, no. And I was just completely taken aback, and Mum was completely taken aback. And that's, I think, the moment it hit me that, hang on a minute, you know, the dynamic has changed completely.
Were you surprised at the attitude, and please don't name the carer, but were you surprised at the attitude that the carer was demonstrating?
Well, I think she was as scared as anyone. It was at that time where nobody knew, and she'd probably been told, the residents are not allowed to see relatives through the fence, and I just naively gone down to have a bit of chat with Mum. And so she was probably scared, and that's why she did it. I mean, she wasn't doing it to be nasty.
But it was out of character, I suppose.
Oh, totally. Yeah, it was this sudden, it was just like a switch being flicked, yeah.
There was another incident that you refer to in paragraph 18. This is an occasion when your mother coughed.
Yeah.
Can you just explain that, please?
Well, again, I think this was just the culture of fear that was going on, and it was in very early days of the lockdown. And Mum did have just a cough. It wasn't an infection or anything. It was just something that happened to her. She used to choke a wee bit, and she'd been shuffling down the corridor with her Zimmer and gave this cough, and the nurse on duty literally turned to her and said, "Go to your room." And Mum just did as she was told, and that was her put into isolation. Now, I can see the nurse was worried, but there's ways of communicating that. And again, that was my intelligent, dignified mother being treated like a kid and, you know, get to your room, and that really upset her. She phoned me that night and she was very upset. And my response was, well, Mum, you know, if I put my nursing hat on, I can understand if you had a cough, but I know to the day she died, she was very angry about that.
Yeah. Again, please don't name the care home manager, but in paragraph 20, you indicated that you got on very well with her.
Yes, and I have absolutely no criticism of, in general, the care that Mum had in the care home. They were very, very good. And yes, I got on very well with the manager. She was, what I appreciated, she was always accessible. Her office door was always open, and I got to know her very well during the first year of COVID.
And she apparently, according to paragraph 20, had a particular view about essential carers.
Yes, way at the beginning, you know, when we were just completely shut out, and I was saying to her, why can I not just be part of the care team? And she absolutely agreed. She said, yes, I think you should be an essential carer. And she was the first person that said to me, she said, I think this is against your human rights, which I hadn't thought about. I was just a daughter who was upset that I couldn't see my mum. And she supported all my, you know, I would tell her, you know, I'd be saying, Mrs. Blah, you know, where does your guidance come from? I had no idea. I didn't know how it worked. And she said, well, we get letters from Jean Freeman at Scottish Government. And I said, well, I'm going to write to Jean Freeman. And she'd go, yes, you know, go for it. So, yeah, she supported all the campaigning and all the kind of knocking at doors that I was doing.
Yeah. When did you start campaigning and knocking at doors? Cool.
About sort of June time, May, June, when the restrictions on the general population were beginning to ease, and just nothing was changing in the care homes. And poor Mum was just despairing, because she was seeing what was happening by reading her paper, watching the news. She knew that we could form bubbles, that hairdressers were opening, that Eat Out to Help Out was happening. And she would keep saying to me, what, you know, I'm a prisoner, why can I not walk out of this door? Looking for me to be the fixer. And so I just was writing to anyone, everything I could think of. And then the day that through social media I met with Cathy Russell, and that was the start of the Care Home Relatives group, which was a complete lifesaver. So that's how it kind of started. But I've been writing to whoever I could think of, HC1, Public Health, MSPs, Jean Freeman, prior to meeting with Cathy.
Okay. We have heard a lot about window visits, and I think we've got a pretty clear idea of how unsatisfactory they were, both for the resident and for the loved one on the outside. But your mother, because she wasn't suffering dementia, she was clearly, as you say, sharp as a tack. She she would be able to communicate with you through a window visit.
Well, she was on the first floor.
Yeah.
So if she could get somebody or manage to get to her window, I could drive across the road into a lay-by, which was the slope of the road. I was a bit higher up. And I would phone her on her landline, and we could chat, and then I could wave at the same time. Mm-hmm. But I found out later, I didn't know then, but she said every time I drove away, she just would cry. And I mean, I certainly cried when I drove away, so there was nothing beneficial about it.
Yeah, you say at paragraph 24 that this was not meaningful contact.
Oh, not at all. Not at all.
And again, you, as you just said, that you discovered that it really upset your mother, and that she would cry when she saw you leaving. I think you also say that window visits were one of the cruelest things, especially for care home residents with dementia.
Yeah.
So this is looking at others, not obviously your mother. Can you just explain, it may be obvious, but can you just explain your reasoning for that?
Well, Mum used to get upset about the ladies on her floor who had a degree of dementia and didn't understand what was happening and why they couldn't see their families properly. And then she would phone me and say, I'm so sorry for Mrs. Bloggs, or it was, I had to help this lady in room blah. And I guess as I got more involved in the group and saw the photographs coming in and heard the stories of these window visits, I mean, there was just nothing compassionate about them. And the fact that people had to wear masks and a closed window. And I mean, I always used to say, if you put your dog in, I like dogs, if you put your dog in quarantine and then said to the owner, well, you can go and wave and knock at the window so that your dog can see you, but you're not allowed to go in, would people not say, well, that's pretty cruel? Well, to my mind, that's what they did to human beings.
Just again, perhaps an insight, is that your mother, I think, did appreciate the seriousness of the COVID pandemic.
Yes.
But I think you say that she couldn't really understand the logic of the restriction.
Yeah.
So again, from the perspective of a 96-year-old lady at that time,
yeah.
Why was she having difficulty with that
because
that logic?
She was sitting in her room day in, day out, and she would have the carer coming in to give her a shower, the admin lady bringing the menu, the catering staff, the laundry lady coming in, the handyman to fix the bed that was broken or check the fire alarms, the manager. All these people were a team that had to look after Mum. So that she, by nature of being in a care home, she required that human contact. And yet they were coming in and showing their photographs on their phones of their kids and having all this chat. I lived 10 minutes down the road on my own, completely on my own, and she said, why can you not follow the same PPE as these people and be part of the team, which was from day one what we were looking for. And she just couldn't understand the logic, and to this day no one's explained that logic.
If that were a question addressed to you,
Pardon me?
If that were a question addressed to you,
yes,
to explain the logic, could you explain
no.
it? Now, in paragraph 29, you talk of 11 long months between March 2020 and February 2021. You say, if I could have been with her just a few times a week following the necessary IPC regulations, it would have made all the difference in the world to her.
Absolutely. Absolutely. She wouldn't have felt alone, isolated, scared. I could have done all the little personal things that kept her going. Yeah,
and you tell us about those little things. You did her washing for her.
I did.
And I think you also arranged plants and flowers in her room.
Yes.
And one of the things she asked you was when would she be able to go back to that?
Yeah.
And you weren't able to tell her?
No. And it was a year before I was allowed back into her room.
Mm-hmm. Just looking at I think we can understand the impact that must have had on your mother. What was the impact of that period of 11 months like on you?
I felt guilty. I used to, when she phoned, I would find that I wasn't telling her that I'd met somebody for coffee or someone had been to the house or things that I'd been doing, because I felt bad telling her that. And so I would say, oh no, I haven't been doing anything. And yeah, and then I felt I was lying to her, and it was very difficult. It was very difficult.
Yeah. I think we mentioned earlier that your mother was very proud of her appearance.
Yes.
And I think you say in paragraph 32 that because of the restrictions, particularly I think on having a hairdresser,
yes,
she had become ashamed of her appearance and completely demoralised by it.
Yes, she, from all her life, from the 1930s to the day she died, Mum had what we'd call big hair, and she always had a beautiful perm, and every week Mum went and got her hair permed, and when she couldn't have it done for 8 months and it just was flat and hanging with a Kirby grip in it, she hated it, absolutely hated it, and I think anybody would become demoralised.
I think you say in paragraph 32 that 4 months previously your original plea to Jean Freeman and Public Health had been, quote, please let Mum have her hair done.
Yes.
Was that important?
Yes. And everybody else was going to the hairdresser by that time.
Mm-hmm. Yeah. Another irony, perhaps, that you mentioned in paragraph 33 was that your mother, because she had understanding, comprehension, she would observe restrictions, isolation, remain in her room.
Yes.
But there were others who didn't.
Yes.
I think we've heard them called as wanderers in the building, because
yes, or
they
ladies
have
that walked with purpose, that didn't understand.
It's probably a nicer way of putting it.
Yeah. Yeah.
And so there was the irony that your mother had to comply and did comply.
Yes,
but others didn't.
Yes, because they didn't understand about that.
You do use the word stir crazy in paragraph 33. Again, probably going over the same material, but how did she manifest that to you?
Well, I think if you can imagine somebody that liked to exercise and walk and do her quizzes and go out with me, if you can imagine sitting in the same chair for 2 weeks, only she wasn't a great lover of television. Her love had been craft work, which she could no longer do because of her illness. She wasn't a great reader. So, you know, the highlight of her day was chatting with people and socialising, and to then be left for weeks at a time in a room, I think stir crazy is the best way I can describe it. Mm-hmm. She would be despairing when she phoned at night.
Yeah. Perhaps a point just following on from that. Paragraph 34, you say she had a safety catch on her bedroom window, and she would sometimes say to you that if it wasn't there, she would jump out of it.
Yes.
And I don't think you thought that was a suicidal ideation.
Not at all. No, I'm not saying that she was suicidal, but she say, oh, you know, dear, if that safety catch wasn't on the window, I'd just jump out of it. And she hated the safety catch because she loved fresh air and she couldn't open the window wide, but that was just a care home thing.
Yeah. And I think you say that that was indicative of her frustration.
Yes.
You saw a decline in your mother's demeanour during the lockdown. This is paragraph 37. Again, can you just give us a little context of that?
Well, she was just despairing because all the little things that she liked, you know, just silly things to, you know, have her jewellery polished and her hair nice and her room nice and her clothes. I used to iron all her clothes and have them nice, and I wasn't allowed to do that, so they were sent to the communal laundry. So everything, life was just, she just said, it's not, what's the point? That's a phrase she used to say, what is the point, dear? I've been here too long, what's the point?
Essential visiting, you mentioned also in your statement. You didn't ask for that because your view was, understandably, that your mother was not at the end of life.
She wasn't at end of life, and I know there's been chat about definitions of an essential visit. I would just say everyone needs an essential visit. It's essential for everybody. But she wasn't end of life. She didn't have dementia. She didn't have mental health issues, and she didn't have autism, which are all the kind of key words that public health keep referring to when they talk about essential visiting. And she also, I'm sure, if I'd kind of pushed it with the manager would have allowed it, but Mum then would say to me, you can't, dear, you can't come in if Mrs. Bloggsy's daughter can't come in. You know, she would feel bad if people saw me coming in and their family wasn't allowed in.
Just on essential visiting, and obviously concerned about definitions and what categories people can fall into when they're an essential visitor for a resident. Do you consider that every person within a care home should have an essential visitor?
Well, my humble opinion is the word essential should be dropped because it's just causing so much confusion. And from day one, when someone goes into a care home and they have a husband, a wife, a mother, a daughter, a son who's an integral part of their care, it should be recognised that Alice Hall has a, call it what you will, key contact person, key partner, key person, that important person in their life who is part of their care team. So it's there with the carer, the nurse, the gardener, the handyman, everyone else that's part of Mum's care package. And I should be recognised as that, the husband, the wife. And that's in normal times. So that happens, oh, yeah, Sheila's, Alice's key person is her daughter. And then, God forbid, if there's an outbreak of anything, that key person is still part of the care team. And if there have to be restrictions in perhaps the time that's spent in rooms or the amount of time people go in and out, as happened to the cleaners, the carers, then that applies to me as well. But we are never shut out under any circumstance. And if that was in place from day one, when someone enters a care home, I wouldn't be sitting here today.
I think it probably answers this question with that last comment. But would you, do you see there being any purpose, particularly, in categorising the situation of the resident as either end of life or someone with dementia or autism, so and so forth?
No.
Is it just the fact that the person is a resident?
Absolutely, that they are, that's the community they live in. But part of the team looking after them should include, surely, their husband, their wife, their daughter, their son, that one key person. So it's like a safety net that if everything has to shrink down because of another pandemic, their key person will still be part of the core team. I mean, Mum always said that, you're my most important carer, and you've been shut out.
you tell us a little bit about garden visits, and again, we've heard a lot about garden visits already in the inquiry, and I think we know a lot of what you say in relation to garden visits.
Yeah.
Just picking up a couple of points. There were difficulties because as you say in 43, your timetable wouldn't always align with the slots that were available.
Yeah, yeah.
And you say at 44 that it was a supervised visit. You couldn't touch your mother couldn't touch you. And you say it was like a prison visit.
Absolutely. Not that I've ever visited a prison, but yeah, it was the fact that, you know, it was so regimented, it was timetabled, so, you know, you'd be doing something during the day and think, oh gosh, I don't want to be late, You had to arrive half an hour early to do the test because we weren't allowed to do them at home, and I would sit in the garden in the rain or whatever was happening, and you're watching this door and waiting, and then the carer would come out with Mum in her wheelchair, and park her, you know, far enough away, and I'm wearing a mask. Now, thankfully, the manager in the care home, you know, said, look, you know, after a couple of visits, your visits don't need to be supervised. I mean, can you imagine my mum sitting with the very nice carer right beside her and me 6 feet away shouting at her? She couldn't really hear because her hearing aids had started playing up just as COVID hit. We were on the flight path to Glasgow Airport, so every 4 minutes there was a jet going overhead. It was not good.
You describe it as hell.
Yeah.
There's a couple of instances. One is at paragraph 47 going into paragraph 48, and there's another at paragraph 61. These were instances where there was compassion shown.
Absolutely. By
some of the carers, and without wanting to cause any problems, they did things that they shouldn't have been doing to allow you to see your mother and to have some meaningful contact with her.
Well, yeah, just the way they would sit close to Mum and say, oh, I'll give your Mum a big hug because I know you can't. Mm-hmm. Which just to me was ludicrous, absolutely. And they were being kind, they were the kindest people. But they didn't realise how that just, you know, I'm sitting there and they're saying, I'll give your Mum a hug for you. No.
Your mother celebrated her 90th birthday on the 17th of December 2020, which
96th.
I'm sorry, 96th, which is at paragraph 50 of your statement. And you say, this is the first time I was allowed into the care home since the regulations had been put in place 9 months previously.
Yes.
I take it that was a particularly significant day for your mother.
Absolutely, absolutely. But it wasn't in her room, it was in a room that the care home had set up. Yeah,
it wasn't. You weren't in her room. You had to. It was a designated room for that room.
Socially distanced. Yeah.
Now, paragraph 52. This follows on from you noting that your mother had her first vaccine in December 2020. And a little while after that, you received a phone call from your mother's GP confirming that you had agreed to do not resuscitate notice on your mother.
Yes, yes. Just after her vaccine, Mum got COVID. So the GP, it was obviously part of her remit, was to phone the relatives and explain this and talk about the do not resuscitate regulations or request. And Mum, I talked about it with Mum, and she said, "Oh, I'm not going to hospital. Don't send me to hospital if I get COVID." And she was quite adamant about that.
Well, I think you say you put on your nursing hat.
Yes.
And were pragmatic and accepted.
Yes.
That should be the case.
Yes.
I think you're slightly critical of the tone that was used by the GP, and I think possibly one of the things we've heard that there are ways of dealing with this matter, and it can be done with a degree of compassion and
yes.
And carefully.
Yes, unfortunately this GP didn't have a particularly soft manner, I think I'll just say. And what I did say to her was, well, that's fine, I agree that Mum will not go to hospital, but if she becomes very ill and is end of life, I will be beside her, looking after her, and I will break down every door to be with her. And the reply from the GP was, "Oh, you seem to know the rules better than I do." And that's how it was left. Mum actually was not particularly unwell with COVID, and I didn't have to break the door down, but
yeah. I think we've mentioned the well, you mentioned that your mother had a number of medical issues, and at paragraph 54 and following, you talk about her various hospital admissions.
yes,
And I think there were a number of these, and each time she returned to the care home, there was a period of isolation.
yes, yes.
You do refer to an incident at paragraph 58 of your statement, when your mother had been admitted to hospital, and you went to the hospital, and as you describe it, you were met by a beefy security guard.
Yes, yeah.
And can you tell us a little about what happened?
Well, it was the Mum was initially admitted with breathlessness, which we're never sure what. It wasn't COVID. It was probably a cardiac episode, and I'd left her the day before at the Queen Elizabeth Hospital, which is the huge Glasgow hospital, and I wasn't allowed to stay with her or anything because she had breathlessness, which put her through the possible COVID pathway. So I had to leave her at a door, and just keep in touch by phone. And then the next day I went, and she'd been transferred to an elderly care unit within the grounds, and I was told she was in this unit. So I went to the unit, which is quite a long walk away from the main hospital, and it was a wild, wet, windy November night, and at that unit there was literally a security guard with a high-vis jacket at the door, and he said, "What ward are you going to?" And I said, "I don't know, I've just been told Mum's in this unit," at which point I didn't know if Mum was moribund or breathing. I had no idea. And he said, "No, you can't get in," because I didn't know what ward it was. He just said, "No, you can't get in, you can't get in." And I was despairing, and he eventually allowed me in to speak to a lady who was sitting behind a glass desk screen, who I thought was sort of reception. To this day, I don't know who she was, but she just said, "Oh, I can't tell you, it's data protection, I can't tell you what ward your mum's in." And she said, "If you just go outside, there's a notice sellotaped to the door with all the ward phone numbers on it. Phone them and find out where she is." So I'm standing out there in the wind and the rain. There was about maybe 6 numbers, and of course I would phone, it would be engaged, 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 try again, engaged, engaged. I must have been out there for 20 minutes, by which time I was bawling my eyes out, and I eventually got through to a ward where they said, "Oh yes, your mum's in this ward," and I said, "Well, can I come and see her?" And they said, "No." I was despairing, and they said, well, if you go to your car, we'll try and FaceTime you. So I went to the car, and of course that didn't work. And then it was a male nurse, I remember, said, well, come to the door and I'll point you to where the window is. And I clambered over mud and grass and bushes to see my poor 96-year-old mum standing shaking with her Zimmer, a television between us and this window. This is the worst window visit of my life, just looking bewildered with a hospital gown flapping around her. And it was the cruelest day that I can imagine. And I got back in the car, and I remember, I don't know how, I was driving under the Clyde Tunnel, phoning Kathy, my colleague in the care home residence, and God love her, she took up the case, and all my colleagues in the group, and they contacted the MSP that we'd had a meeting with, Kevin Stewart, and to cut to the chase, the bottom line was I got a phone call from the chief nursing officer for Scotland, who then put me in touch with the chief nurse for the Queen Elizabeth. And basically the end of the story is the next day I was allowed in to see Mum, who by that time was bewildered, confused and angry. It was torture. It was absolutely torture. And then I think if I'd been a little 90-year-old man trying to see my wife, and that had happened, he probably wouldn't have had a mobile phone, and he certainly wouldn't have had the support of a group and the ear of an MSP. Yeah. So it was bad enough for me, but gee whiz, it was the most inhumane. And I mean, we're not talking early days of COVID. This was the end of 2021, November 2021.
Mm-hmm. You sum up that experience in paragraph 61. Perhaps you just read that, please.
61?
61.
I can't start to imagine how ghastly that same experience would have been for an elderly husband or wife wanting to see their loved one. It was totally barbaric and the worst day of lockdown that I experienced.
You then go on to talk about the isolation rules after following hospital admissions, and I think we understand that. But your mum was able to record a video.
She did.
And was this when she was back in the care home, but in what do you call solitary confinement, or was that from the hospital? Yes,
so all of Mum's hospital admissions were because of falls or a TIA or this breathless episode, so she was never admitted because of COVID. Yeah. And each time she was tested, PCR testing was negative, but each time she got back to her room, she would say, oh dear, that's me in my room for 2 weeks. And she had to sit there for 2 weeks without any extra, contact. And after that November 21 admission that I described earlier, she was back sitting in her room. Now, by that time, I was allowed in to see her as a designated visitor, but other than that, she couldn't do anything else. And she really was, she was angry, and she said, nobody else leaves hospital and has to sit in their bedroom for 2 weeks, nobody. So why do I have to do it? And I said, well, maybe we need to let Kevin Stewart, the MSP, understand what this is like and let public health know what it's like, because this guidance had not been reviewed for over a year. So
can I just stop you there?
Yep.
You're saying the guidance hadn't been reviewed for a year. I get the impression that you would become something of an expert on guidance.
I think sadly I am. I think I probably hold the most comprehensive records of all guidance that was ever put out there, because it was so confusing. As on behalf of the group, I used to try and do summaries of where we were, what should be happening, bullet points. I mean, yeah. So the guidance was very confusing, but I knew that the guidance had never changed. Bits of the guidance had changed, but this rule saying that on discharge from hospital into a care home, the resident had to sit for 2 weeks in their room in isolation, basically, and even with 2 negative PCRs. So Mum was really totally fed up. But she actually in total spent 3 months in solitary confinement in a room when you cumulatively over the time. So I said, all right, well, we'll send a video to Kevin Stewart. She said, yes, dear, I'll do anything. I'll do anything. So together we wrote this little statement, and she recorded it on her iPad, and we sent it to Kevin Stewart, and it was picked up by the Scottish Government team that we used to have regular meetings with, and it got shown at Public Health apparently in their ivory tower, and about a month later the guidance was completely changed, and that 2-week rule was subsequently removed from the guidance. And Mum got a letter from Kevin Stewart thanking her for raising this, and I think, well, if we hadn't, how long would it have gone on for?
Yeah. Right. You tell us about your involvement with the Care Home Relatives Group, and you do that over a number of paragraphs. I'm going to take that with respect as read for present purposes, because we can read it, and you've said it on an earlier occasion. You do make reference at paragraph 73 to the October 2020 article in the Nursing Times that you referred to, and I think you were the person who either found that article because there were certain people you knew had signed that that letter, and I think you described it in your earlier evidence as a light bulb moment for you.
Yes.
Could I take you on to paragraph 87, please? This is still in the context of your involvement with the group, and it may seem a slightly petty issue. I think you probably see that possibly yourself, but I think you see it as being reflective of a wider attitude. Just tell us what you're complaining about there.
Well, this was over the period of time as and involved in the campaigning group. I was looking at my records, and I've attended around 70 meetings with different organisations and government and CPAG subgroups and oversight groups, and this was one meeting that we were asked to be involved in as a group, and myself and one of the other members were asked to meet with the representative from the Care Inspectorate, and it was apparently to do with staffing, but they wanted representation from our group, and this was in March 21, so it was quite relatively early days of our campaigning, and I just was disappointed. What's the word? The way that it was approached. To my mind, it was a kind of, I don't know. Do you want me to describe it? That we were sent.
Do you want to? I mean, it sounds a bit like a fun day out.
Yeah, it was. We were all sent a little box with goodies that had a kind of significance. A Kit Kat when you need a break. A rubber to rub out the bad thoughts. A yo-yo for the ups and downs in life. I mean, this arrived in my house through the post, and I'm thinking, what is this all about? And then we went to the meeting, and part of the meeting was they were going to show us tricks with the yo-yo. I mean, you couldn't make it up. It was so ludicrous. And I mean, I'm not blaming the people that were running this meeting. That was obviously their tack. But I just, at that time, I was jumping up and down saying, please let me into my mum's room, let me see my mum. And they were having these kind of meetings, and I just felt the whole care home situation was demeaned and misunderstood.
Okay. You go on to talk about the lack of clear guidance and support. And again, I think we've heard from a number of witnesses about the problems with guidance. You begin by observing that there was very little guidance for care homes from the Scottish Government or Public Health at the start of the pandemic, when care homes were locked down. With we're going to ask you to put your nurse's hat on again, and your training. Do you think there should have been
Absolutely.
guidance at that stage?
Absolutely. And I mean, ironically, and I guess I never really made this particularly clear, but ironically, when I was running my travel health company, I did consultancy work for public health. I used to run training days for them. I wrote guidance that appeared and is still there on a travel medicine website. I used to help them edit the website. So I guess, without blowing my own trumpet, I guess I kind of understood the importance of clarity and guidance and keeping it simple. And I couldn't believe what I was seeing that was coming out. And there may have been earlier guidance, but the first public health guidance, which was then written under Health Protection Scotland, was their heading at that point. Their version 1.0 was produced in April 2020. And I would have thought that they would have had something ready to produce in March 2020, when at the start of the pandemic, but I don't know. I mean, I'm only saying that as what I observe. I don't know what was happening higher up.
And in paragraph 90, you say that a key issue during COVID was that within public health, there was no one person allocated to be the guidance voice for care homes.
Yes, I feel that very strongly. And at the very first meeting we had with Jean Freeman, I can remember saying that there seemed to be no one person who understood care homes, who was involved in writing that guidance and could be accessed for information when someone had a question. There was no key voice. The guidance seemed to come from this ivory tower. To this day, I do not know who was sitting around the table actually writing the words, because, and again, this is my humble opinion, they were people that did not understand what was happening at the grassroots. And we were at the grassroots saying, look, it's like this is what is happening. There are people climbing step ladders. There are people in tears because they can't get in to see their loved one. And that message kind of got filtered via Scottish Government up to this public health. But it was well over a year before anybody from public health actually spoke to us at the grassroots. And even then, they didn't seem to get it. And even today, they don't get it.
You still feel that that's an ongoing issue?
Very strongly.
Yeah. And what's that based on?
It's based on the latest, well, not the latest guidance. Okay, just to summarise it, my mum died on the 5th of February this year, and I was able to spend the last week with her. It was a very special time. 4 days before she died, I got an email in preparation for a meeting that we were to have where there was going to be a representative from Public Health. And as did happen, they sent me papers pre-meeting. And one of them was to review the latest guidance that had been produced by Public Health. And I looked at it, and the title was version 2.5, COVID guidance for residential settings, care homes and prisons. And I couldn't believe what I was reading. And at that point, Public Health had decided to combine their prison guidance with their care home guidance. And I had listened to my mum for over a year saying, dear, I'm just a prisoner here. And then I'm seeing Public Health write this in the guidance. So I think fit to be tied is an expression I will use, and that's putting it mildly. And
that applied to you?
Absolutely. And I mean, I shared this with the rest of the team. So, I mean, I actually, I don't know what a whip does in politics, but I think I whipped because I sent an email to key people that I'd met at meetings saying, this cannot happen, this cannot happen. And I went to the meeting and I expressed my dismay that this had happened, and the representative from Public Health defended it by saying that they were cutting down on staff and they had to consolidate their guidance. And my argument was, well, in this day and age of online documents and cut and paste, I think it's disrespectful, it's hurtful, and I don't agree. So they went away, and a few days later I got the revised guidance, and they'd taken the word prisons out of the title, but the text remained exactly the same, i.e. all about prisons. So we went back again, and after about 2 weeks, the decision was reversed and the guidance was split. But to my mind, that just underlines how the care home was regarded as an institution. And to have put it together with a prison, I'm sorry, it was unforgivable.
You tell us about that at paragraph 98.
Yes.
In some detail.
Yes.
One other point, if I may, on guidance. And again, I think we're hearing this on a number of occasions, is that the guidance as implemented was not implemented uniformly. It would be applied differently in different locations by different care homes.
Yes.
And you say at paragraph 91 that you use the expression it was a complete postcode lottery.
Yes, and it was so confusing. I'm not surprised it was a postcode lottery.
Yeah, that's what I'm going to ask.
It depended on who happened to be on duty that day, who had happened to glance at the guidance and how they interpreted it. And so many of the statements were kind of left, at the manager's discretion, or discuss this with your health protection team, or, it lacked conciseness and clarity.
I think you've said this already, you would really become the expert on guidance. Don't put yourself down.
Well, perhaps. And I mean, the way that I work, I like things orderly, and so I kept records on my computer. I've got hundreds of documents. I have virtually I probably have the most comprehensive library of guidance, meeting notes, minutes, pre-meeting notes, probably in the country.
Yeah, I think this is interesting in the context of how, in paragraph 94, you say that CHRS became an unofficial helpline.
Yes, absolutely.
And that, did you see that as being your role?
Well, I had utmost admiration for my colleagues in the team, because they were the ones that were getting phone calls and emails and were helping people in a practical way. I think perhaps what I brought to the table was the editing of documents and the writing of letters and the compilation of guidance. And to this day, we all say, I don't know how it happened, but yes, it did become our role. It just evolved.
Yeah. And at 96, you say that you think there's a gap that could be filled by establishing a care home advisory organisation.
Yes.
And who would that be advising?
Well, I think, we realise from the pandemic that when there's actually no body that supports relatives of people in care homes. There is nothing out there that actually supports them, and for whatever reason, whether it's advice about financial advice or emotional support or what to do if the chiropodist isn't coming in, or all these little things, there's nothing out there, and we've been sort of presumed that we'll carry on this role as a group, and that's certainly not what we set ourselves up to do, but we know there is a need for that.
Yeah.
That's for the future to think about.
Right. Can I move to your personal reflections? Now, without reducing their significance, because they are yours and we have them in front of us, but I think I can summarize them perhaps this way. The first is that you and those who are loved ones should be regarded as part of the care team.
Absolutely.
Secondly, you, I think, take offence at the constant reference to you as visitors.
Yes.
You also are slightly critical of the public health characterisation of care staff as highly trained individuals.
Well, this was a comment that was thrown to us from a senior person in public health when we said, why can we not adopt the same PPE as the cleaner, the carer, the nurse? And she said, well, they are highly trained individuals. And I was listening to this from her, and then we'd be getting a phone call from Mum that night saying, oh, you know, dear, I got the new girl today to help me give a shower, and, you know, I'm sure they just come to me because I can tell them what to do. And that new girl would be very caring, but probably the week before was a hairdresser. So I would argue that you can't tell us we can't follow PPE because we can't be as highly trained as the care staff.
And I think in 102 you mentioned that public health continued to introduce restrictive measures without consulting the care home residents. Yeah. And that you see as being something that should happen, whether to be a pandemic or an epidemic that required closure of care homes in the future.
Yes, as I say, we felt we were at the grassroots telling our story. I mean, the Scottish Government officials who met with us met regularly and listened to us and were empathetic and would nod in agreement with what we were saying. But they then, it was like Chinese whispers, they obviously had to take that up to the ivory tower and then defer to what public health brought down again. To this day, public health do not have any good dialogue with us or understanding of what we've...
You do say at 103 that your mum used to say that care home residents were discriminated against.
Yeah.
They were treated as if they had no voice, no intelligence and no rights.
Yes. I think these were the words she used in her video, actually.
Yeah. And taking that further a little, at 104, because you're talking about essential caregivers, you asked the care home manager, out of the 60 residents, how many would have wanted access most days? And I think she said, well, tell us what she said.
Well, she said, well, probably just around 6. I mean, this was during the pandemic when we were saying, why can I not be part of the care team? And she agreed that I should have been part of the care team. And I said, how many we weren't asking public health to throw the doors open and let everybody in, just have the option of having that key caring person. And the manager said, oh, you know, of all my 60 residents, there's probably only about 6 families that would request that as a regular contact. So, and I don't think public health ever got that concept. If they'd allowed it, it wasn't that the floodgates would open and hundreds of people would rush in.
You tell us about your mum's legacy, and again, it's something we can read. She was a huge supporter of your campaign. She went on your original demonstration.
Not the original one.
I'm sorry.
She was locked in then.
I'm sorry, beg your pardon.
September 21, when we held a second demo specifically in relation to Anne's Law. Yeah. And she was determined to be there, so she was there in her wheelchair, yeah.
And she was interviewed by the BBC and STV.
She was interviewed by the BBC at that demo, and then later on she did an individual interview with STV in relation to the National Care Standards.
And she was very pleased to meet Lord Brailsford.
Indeed. It really, I mean, the campaigning kept her going. It really did, and you know, she'd be saying to me, what happened at the meeting, and can you get in yet, dear, and oh, what's going to happen, and then I'd have to say to her, well, nothing, Mum, we had the meeting, and same old, but I used to send her, you know, letters and things to look at, and guidance, and she would look at it on her iPad.
Okay.
Since it's now publicly known that I met your mother, I think I can say that I can stand as a witness for testimony that in her 97th year or 98th year, she certainly had all her intellect intact.
Yeah.
Thank you.
We had a full conversation, which was very illuminating.
Yes.
Thank you, my Lord.
Appreciated it greatly. Thank you.
She sadly died on the 5th of February this year.
Correct.
She had never had, well, she had COVID, but she didn't die of COVID.
No.
And you were able to spend her final days with her.
Absolutely. It was a complete honour. I was with her, to the minute that she passed away, and it was dignified and beautiful and special. And I can't start to imagine how I would have felt if I hadn't been allowed to be with her.
Yeah. Right. Now, your mum had the foresight to leave us a message.
She did.
And she had written down something on the 6th of March 2022.
Yes.
And she addressed it, thoughts for the public inquiry, quote, in case I'm not around.
Yeah, she used to say to me, I'll be well dead, dear, before that inquiry happens.
It was very perceptive.
Yeah.
Right. I'd like you to read that, please.
Okay. So it's from Alice Hall, and this is her words. I am 97 years old. I made the decision to take up residence in a care home because of increasing frailty and falls. I require 24-hour support. I moved to Glasgow from the East Coast to be close to my daughter. She has always been my main carer. Life worked well. My room was my own space. With the help of my wheelchair, we went out and about in the car. I managed to attend church. The hairdresser came every week. I went to concerts. I went to restaurants. I lived a fulfilling life. In March 2020, the doors of the care home were locked. We understood the reason. Society was anxious. I was able to use my phone and iPad so I could keep lines of communication open. We have now reached March 2022, and unlike everyone else in the community, my life is still ruled by guidance, regulation, and constant lockdowns. During 2020-21, I spent a cumulative total of 3 months isolated in my room. I now live with the constant fear of public health declaring yet another managed outbreak in the home, i.e. only one named visitor permitted for another 2 weeks. With so many asymptomatic cases, this is now the constant rolling situation. My friends can no longer pop in. I cannot plan any outings or visits. My hairdresser is frequently to be cancelled at the last minute. We are beholden to the latest update from public health. I have had 3 vaccines. I have had COVID. I have truly had enough. The staff are on their knees. They have worked so hard and with such little recognition. I now do not recognise my carers if I see them without their mask on. For my fellow residents who are bedbound, they will not have seen an unmasked face for 2 years. This cannot be right. My daughter has always been my main carer. This should have continued throughout the past 2 years. Public health must recognise that many care home residents have a friend or family member who play a major role in their lives. Why was this never acknowledged? Using PPE and following all the same regulations as employed staff, why would my daughter have posed any greater risk to the care home or herself? As residents, we all require human contact and care, yet our main carers were locked out. Never believe that a distant garden visit or window visiting was the answer to our isolation. Only someone who has peered through that closed window can ever understand how inhumane, cruel, and painful that token offering was. Please think this through. We are not patients requiring treatment in a clinical setting for a short period. We are members of a community that require extra help, but should not be locked away like dusty antiques. We still have our lives to live, and every day is precious.
Well, thank you very much. Do you feel through that your mother has had her voice in this inquiry?
I think she'll be listening, and yes.
Okay. Just one other point. At the bottom, you give a summary, and effectively these are matters we have gone over, and we understand what you say in your summary. You quote your mother again at the bottom of paragraph 115.
Yes.
Just read that, please.
She was not afraid of COVID or dying, but she was afraid of being alone. She always said that at the age of 95, every day is precious, and I want to spend them with my family, not isolated alone in a room.
Ms. Hall, thank you very much indeed for that.
Thank you.
And for giving your evidence.
Thank you.
Thank you, Ms. Hall. Very good.
Thank you, my lord.
Thank you, Mr.
Good day.
That's all for today. Could I ask you please all to leave except Ms. Galbraith and her agent if she has one? I'm going to hear an application from her. Should have said tomorrow morning at 10 o'clock. Could you get Farima's attention for me? Could you go and tell Joanna Mortimer if she wants to come in